Now I'd like to introduce Michael Singer, who'll be giving an update on the latest with Veyo. Thank you.
In the last 5 years, we've seen a lot of advancements, huge advancements in consumer transportation. Most of us came here using a Lyft or an Uber. But in healthcare, every year there's about 4 million Americans who miss their doctor appointments because they don't have adequate access to care. At Veyo, we wanted to solve this problem. We started Veyo to solve this problem, and we're trying to build an end-to-end solution that's going to solve the challenges that we find with healthcare logistics. We're using GPS tracking, we're using predictive analytics, we're using the concepts of ride-sharing, all of this to increase access to care, to improve healthcare outcomes for patients, and at the end of the day, to just drive everyone to their healthcare appointments. So members can create trips in the system, or they can generate trips in the system through a bunch of different ways. They can use a member app to create trips, but for those who don't want to use an app or don't have a smartphone or just want to talk to someone on the phone, they can call a call center. But we're going a step forward, and doctors or healthcare providers, everyone can create trips in the system, either through UIs or through APIs, where they can create and manage trips. And then when we built the system, we built it with the healthcare provider in mind. And healthcare providers, doctors, everyone can kind of access their own trips. And they all have access to live trip data, live analytics about what's going on, but also they have access to seeing data about the drivers that pick up their members, their patients. They can see what level of credentialing these drivers are going through. When was the last time they took a CPR class? When was the last time they did a drug test? What vehicle they're driving? There's a wealth of data that healthcare providers, doctors, everyone has access to. And so that's on the healthcare side. The other side is the people who are driving our patients. For us to be able to provide 100% of our trips, we have patients with different needs. So we've created this blend of ride-share drivers together with traditional transportation providers, and we call this our virtual fleet. Using this fleet, we can support any type of trips, from sedan, regular ambulatory trips, to wheelchair-accessible vans, bariatric stretcher vans, and many different modes of transportation, and everything can be managed through the platform. The providers get the portal where they go in and manage their own trips. So this is our Veyo platform. Now, we have a lot of patients, and again, we want to make sure that everyone gets to their healthcare appointment on time. So we use a blend of predictive analytics to look at supply, demand, and driver behavior, and create these models where we can support trips in every geographical area. We support trips in high-density downtown type areas, but we also have a lot of trips that are happening in rural areas, places like rural Idaho or Grand Canyon. We have about 30 trips a year in Grand Canyon, and we use all these analytics to make sure that we create the right distribution and dispatch models for each one of these different areas. We've been around for about a couple of years. We're in 6 states. We manage 2.5 million trips a year. In every state, every customer we've started working with, we've decreased fraud, waste, and abuse, and increased the metrics that we're measuring and customer satisfaction. We have a booth in the room, and we're happy to see you come by and talk to us. Thank you.